Go ahead and turn this over to UNM Hospital Chief Quality and Safety Officer, Dr. Rohini Mckee.
Thank you, Mark, and good morning, everyone. Thank you again for the opportunity to talk to you today. UNM Hospital continues to see an increase in COVID-19 patients. As you know, we have had a high census for several months now, mostly due to patients who delayed care during this pandemic, particularly a rise in trauma patients. And as you know, we were named the first and only comprehensive stroke center in New Mexico, and so we see a lot of stroke patients as well. So the rise in COVID patients layers on top of that, and has led us to be very full both in the intensive care unit and in our progressive care units. And so we encourage all New Mexicans to go to vaccinenm.org and encourage you to seek out the facts about these safe and effective vaccines and get vaccinated if you are not. I think the consequences of the decision not to get vaccinated at this point in time for all New Mexicans could not be more clear. As you know, our children went back to school over the last couple of weeks. We know how important it is for them to remain in in-person learning. We know how important it is for our businesses to remain open and for us to engage in all the fall activities here in New Mexico that we enjoy. We can do all those things, but it requires us to go back to basics, to do the things that we know work against this virus, and to not give the virus a chance to mutate into yet another variant that could potentially escape these vaccines that we have now. So we highly encourage you to seek out professional advice from your physicians or your healthcare providers and get vaccinated. Thank you again for allowing me to be here.
Thank you, Dr. Mckee. And next we will go to Presbyterian Chief Medical Officer, Dr. Jason Mitchell.
Thank you so much for including me. As we look nationally, the rise in COVID is alarming. If you look at the modeling nationally, you see that in the next 3 weeks, we're probably going to hit 1.4 million cases a week in the United States. And I want everyone to remember that the highest peak of the pandemic so far was 1.7 million cases a week. In that same modeling, we don't see it rolling over before it hits and exceeds that across the United States. And so we are headed as a nation to the highest spike we've ever had. We have an opportunity in New Mexico to not have that happen to us here locally. And that's because we've worked together and we have vaccinations at higher rates. And so we're at a point where we have to pull together, get more vaccine into arms, into people, and bend that curve. And as you've heard, and you will hear from all of us, our hospitals are already completely full and well beyond capacity. And we know that the work we do today doesn't change hospitalizations for a few weeks. And so we need people to pause, to see what's going across the world and the nation, to look at New Mexico and know that together we can make a huge difference like we have before. We prevented the first 2 surges of COVID. We got caught up in the 3rd, but brought it under control. Now we're in a 4th, and we have the ability to bring it under control very, very quickly with just a little bit change in our behavior of more caution when you're out, more masking, obviously avoiding contact with others if you have any symptoms. And if you're not vaccinated, please get the vaccine. It's safe, it's effective. And we know that 99% of people getting COVID now are the unvaccinated, 99%. If you get vaccinated, you're safe. And if you don't, you're not. I know people hear about breakthrough cases, and yes, they can occur. But when you step back and really think about it, the people that are getting COVID and getting sick are unvaccinated. So I appreciate the time here today and look forward to your questions and understanding how we can continue to help.
Thank you, Dr. Mitchell. Next, we'll go to Lovelace Chief Medical Officer, Dr. Vesta Sandoval.
Thank you for allowing us to come in front of you, answer questions, and bring these important messages to the people of New Mexico. Currently, I'm going to reiterate what my colleagues have said. Our hospitals are full. We have very acutely ill, very high acuity, and on top of that, we're receiving a high number of COVID patients. We do have the ability to control this. All of the things that have been mentioned, social distancing, washing hands, wearing your mask, and most of all, getting the vaccine. And I know every week I come on here and I say, think about, look, get the vaccine, look for the vaccine, try and go where the facts are. And if you've had the vaccine and you know someone who doesn't, take some time to talk to them about why you got the vaccine. Think about that, because right now, people that are unvaccinated are at risk for hospitalization and death. We know that. Everybody in our hospital right now that's hospitalized is unvaccinated. You can stop this and stop the spread of this if we're careful and if we go out and get the vaccine and keep ourselves and our community safe. Thank you.
Thank you, Dr. Sandoval. We'll go ahead and open it up for questions. If you have a question, please let me know in the chat and I will call on you. We'll start with Ryan Laughlin at KOB, and then after Ryan will be Julia Goldberg at the Santa Fe New Mexican. Go ahead, Ryan. I'm sorry, Santa Fe reporter, Julia. Go ahead, Ryan.
Thanks, Mark. I have a quick question now that some healthcare workers are mandated to be vaccinated. What are you guys anticipating seeing? What have you already seen from the people that employees and healthcare workers that have been vaccinated and some that might not want to, how you plan to address that moving forward?
I think it's important to recognize that the vast majority of healthcare workers already are vaccinated. And so, we are really appreciative of those who went first. And so we're not working from a zero starting point. We've got high rates of vaccination. This is the next step for it. I think our state has been very clear. This is a requirement. This is a requirement to care for patients in the state, is that you must be vaccinated if you don't have a clear religious or medical exemption. And so we really are working with our employees to understand any barriers and help them through that. We do have appropriate processes to respect those exceptions, which are going to be few and far between. And it really is just a matter of understanding people and then trying to help them get to the point where they need to get. I think, this is not about anyone being good or bad. This is about us working together as a community and also respecting people's choices. And we will respect those choices when they fall within the guidelines the Department of Health has set.
So, sorry, go ahead.
Oh, no, I was just wanting to know if you guys are tracking hard numbers. You said a majority of your healthcare workers are vaccinated. Do you guys have hard numbers on the numbers that are not vaccinated? And if there are refusals, are you anticipating healthcare worker shortages if, we can't meet this requirement?
Absolutely. We do track the numbers of vaccination. We are required to by the Department of Health public health order requires us to track that, and I think probably every single one of us was already tracking it, and we will provide that reporting to the Department of Health as well. And so, we are held accountable for this, and we are all in on vaccinating our workforce, because we need every single member of our team, every single caregiver, every single person that works in an organization to be healthy and safe and present to take care of the ill. And every member is needed. And so, and vaccine is what provides that protection.
And I would say again, just to reiterate, we do track numbers. We are planning to report those numbers and have reported those numbers, and we do have processes in place. And it is exceptionally important that, again, that we follow the governor's order. And we do have many physicians and other leaders within our organization who've really stepped up and been very vocal about the importance of vaccination. I think our healthcare workers realize and understand the importance of vaccination and are totally supportive.
So at UNM Health, we have had a high vaccination rate within our health system. And we do track as well and do reporting much like the other health systems, like you've heard. We have frequent town halls to answer questions about vaccines and help to dispel any myths that exist around them. And we also give out information to our employees about accommodations for those who cannot be vaccinated for medical reasons or religious reasons or due to disability. But we do make every effort to have respectful dialogue with those who are hesitant, and provide them with facts frequently and answer all questions that they may have.
And sorry, just a one last follow-up. Are you anticipating having any sort of terminations, or what happens with if somebody absolutely refuses to be vaccinated and it's a requirement?
So the public health order is quite clear that if you have not received your first shot by Friday next week, I think it's Friday next week, that you cannot enter the healthcare facility, and at UNM Health, we intend to follow the public health order to the letter.
Thank you very much.
Thank you, Ryan. Also, just a reminder to everybody, with the exception of the person speaking or asked the question, to please be on mute. Next, we'll go to Julia Goldberg of the Santa Fe Reporter. After Julia will be Dan Mckee of the Albuquerque Journal. Go ahead, Julia.
Thank you, Mark, and thank you, doctors, for your time today. I wanted to ask you, historically, according to the health department, close to 21% of people who've been hospitalized with COVID-19 have sadly died. That includes, of course, before some of the interventions and some of the medications that are available were being used. I wonder if you sort of see that same, I don't necessarily know if you have those hard numbers, but if you see that same kind of pattern now in terms of patients that are coming in with COVID-19. And my second question, I was hoping you could talk a little bit about, Dr. Scrace showed us some graphs earlier this week about hospitals reaching contingency and crisis of care standards. And I didn't know if you could maybe explain a little bit what that might mean for your facilities or what it means already. Thank you so much.
Julia, I can address the first one. Sadly, you're correct in that percentage of mortality, and the mortality rates are still very high. I think that the other thing to recognize is that we are seeing younger patients and patients that don't have the same number of comorbidities that we did previously. So we're seeing younger, healthier patients come in and also, sadly pass away from this disease that is clearly preventable if we get a vaccine.
So to answer the first part of your question, it's a little difficult at this point in time to comment on the mortality rate, but the absolute numbers of patients really aren't enough to give you a sort of a statistically sound rate. So we don't have that yet, but we are also seeing this time around that the patients tend to be younger and be healthier at baseline, which is of course concerning. With regard to crisis standards of care, that is a situation where you start to look at what is good for the community as a whole, rather than what is good for the one individual ahead of you. We do not want to get there. We have worked very closely together on all of these health systems that you're seeing here on the call today, and as well as those in other parts of the state, to avoid that in the past, though we came very close. And that is why it is really critical that we act now to change our behaviors and to increase our vaccination rates, because we have started this surge at a place where all the large health systems were at capacity. So there's not a whole lot of room in the system here. And that's why it's even more important that we engage in those behaviors and go get vaccinated now without delay. Thank you.
And just for some additional data, if you step back at everyone that's getting COVID right now, the crude mortality rate is 2%, and the hospitalization rate is 4%. And so to put that in common terms, if you and your family in your home, and you look at your two next door neighbors and the neighbors across the street, if you all got COVID, at least one person would be hospitalized. And there's about a 50% chance that one person of those groups would die. If you add your neighbors, their neighbors, and across the street, then you could guarantee that one of those people is going to die if they all got COVID. So I do want to share with when you get COVID, it is not a benign disease. It is very dangerous, and it's a 2.1% of dying from it. It is about a 4% chance of getting hospitalized from it. And going to the ICU about a 2.5% rate. And if you're in the ICU, it's about 57% of people in the ICU currently in New Mexico are intubated with COVID. They're in the ICU, they're intubated. And so this is real, and those numbers always seem a little off until you think about, 4 people per house on average, and just the houses around you, you'd make up 100 people. Imagine them all getting COVID, and imagine the outcomes from that. I think the other important thing to remember is that the Delta variant is exceptionally contagious. It has what's called a R0 of about 6, which means for every one person that's infected, they spread it to 6 people. So it goes from 1 person to 6 people. With 6 spread to 6, that's 36. And those 36 spread to another 6. And you can see how it grows so quickly. As we looked originally at the first strains of COVID, it was closer to 2. And it went from 1 to 2 to 4 to 8. And so you can imagine that it would spread through your neighborhood much quicker. And so things are very, very different now. The mortality may not be that different, but the spread and the people impacted is much worse.
Thanks very much.
Thank you, Julia. Next, we will go to Dan Mckee of the Albuquerque Journal, and after Dan will be Chris Mckee at KRQE. Go ahead, Dan.
You have shared some figures about the number of breakthrough cases that end up hospitalized. And it looks to me like, based on the state data, that perhaps as many, that fully vaccinated individuals may make up 10 or 11% of the hospitalizations in the last 2 weeks. It's possible that those numbers aren't accurate because they're just based on public reports and there may be some technical adjustments. But I'm wondering if you can address whether you are seeing that many vaccinated individuals end up hospitalized, whether that figure is going up, and any other message you would want to share for the public on breakthrough cases and the possibility of being a vaccinated person but still ending up with a serious problem.
I'd be happy to tackle that. So we are seeing a small percentage of patients in our hospital who are not vaccinated. It is less than 10% of our patients who are hospitalized with COVID, and they are not in the intensive care unit. And what we do know about this virus is that if you are vaccinated, first of all, there's about a 25-fold reduction in your chances of needing hospitalization. And then there's a 25-fold reduction in the chance that you will die of COVID. We also know now that if you do get COVID after vaccination, your duration of symptoms is shorter. So you may get ill, but your duration of symptoms will be shorter, and there is less chance that you will transmit the virus. And so no vaccine is perfect. In the history of vaccines, there have always been breakthrough infections. But when you look at the reduced transmissibility and the reduced chance of needing a hospital bed, and you think about how transmissible this virus is, you take a step back and look at the good that vaccination does for the community, it makes for a very compelling argument to go get vaccinated. Thank you.
Thanks, Dan. Next, we'll go to Chris Mckee at KRQE.
Hey there. Thank you very much for taking the time to take our questions this morning. First, I wanted to start with maybe ventilators and just sort of maybe the overall status of how many patients you have on ventilators, or maybe a percentage of patients. I was looking at the state's sort of reports showing that it showed around 25% statewide were patients on ventilators, but I was wondering if perhaps the individual hospitals could kind of speak to that. Is it as big of a deal as we thought in the beginning of the pandemic that we were going to be in need of sort of ventilator space and whatnot? I wanted to, I guess, start with that question first. Thank you.
I can start with that. And so I mentioned before, as a state, of the ICU patients with COVID, about 57% are on ventilators. I don't see the equipment being the limitation. The limitation is having the staff to run them and care for patients. It's having our nurses, having our intensive care doctors, having our pulmonary therapists. That's going to be the limitation. it's not going to be the equipment this time around. And so what we really need to do is make sure that every single one of those individuals is vaccinated and protected so they can be there in the ICU to take care of our patients. And we need to have less COVID spread. And so we need the whole community to get vaccinated so that we don't run out of people to take care of you. All those individuals are already fully taxed. If you look at our ICU capacity in New Mexico, you'll see that most of us range between 110 to 130% capacity above, so we're well above capacity. So there's really very little additional room. And so we've got to have folks vaccinated and protecting themselves. And we need our employees and our providers and our teams vaccinated so that they don't get ill and they can be there for our patients.
And again, we want to stress the capacity is over capacity at this point across all of our ICUs. And in addition, these patients are progressing in their illness and becoming quite ill, ending up on ventilators. That's our experience. I think it's everyone's experience. And it's just this disease is that devastating. So we need to understand that if you become that ill and you're in the ICU, there's over a 50% chance of intubation. And that once intubated, then the prognosis is very grim. So we want people to protect themselves and understand this is a big deal. It is, in your question, you're saying, is this a big deal? It is. We need to control as much as we possibly can and take control over what we can with this disease.
Add on to that, I wanted to ask as well about booster shots. You guys were all very instrumental in helping get out the first and second rounds of vaccinations out in the community to begin with. Now that we've got these sort of booster shots on the horizon, do those types of clinics start to maybe in planning for those clinics start to sort of the gears start to turn on those again? And can you maybe give us any insight on how you're planning to handle booster shots in the next few months?
Yeah, so I think it's really important to recognize that the booster shots we're talking about right now are for immunocompromised individuals. So a very small number of individuals that there's unlimited vaccine across the state right now. You can go to any pharmacy, almost any clinic and get it. And so from that standpoint, the mechanism's there. As we think about boosters, it's going to be likely folks that have been 8 months out from the first shot. And so you're going to see a rolling wave because you remember we prioritize people in the first place to get vaccine. And so those same prioritization groups will roll in at 8 months out. So it won't be everyone at once, which gives us time to get folks vaccinated. At this point at Presbyterian, we have vaccine in our primary care clinics, in our OB clinics, in some of our chronic care clinics. All of the local pharmacies have vaccine. Our healthcare partners have vaccines. So I don't think we're going to have big hubs this time around because we have it within a couple miles of everyone's home. And that's really what we need. And so people need a vaccine. If you look left and look right, you're going to find some place that has it. You're going to see a sign on the street. And so I think it's going to be a really different mechanism. I don't think people have to wait and they have choice. You can even pick your vaccine now. So if you're worried about one, you can pick a different one. You got three great, you'll have, I guess on the boosters, actually 3 great choices, all 3 of them most likely. So I think it's going to be much easier this time, and it's really less about big hubs and more about go locally and whatever is easiest for the individual.
So I agree with Dr. Mitchell. At UNM Hospital, the first time around, we ran very large, very efficient clinics within our facility to make it easy for our employees to get vaccinated. And we have started planning for that, possibly for sometime next month. We don't have an exact date yet. But this time around, it is so much easier to get vaccinated. And our priority right now is to offer the vaccine to all our healthcare workers who have not been vaccinated yet. And then once that is done, we will move on to operationalizing the booster doses for our healthcare workers. Thanks.
And for the immunocompromised patients, there is quite a long list of the types of patients that would qualify for those shots. They should talk with their oncologist or their rheumatologist or their primary care physician. They can consult with a pharmacy and they can see if they're candidates or if they are the targeted population for that third booster shot for the immunocompromised patients.
In the hospitals is a younger population of those coming in with COVID. I know you guys spoke to that, but I maybe wanted to ask if you could expound upon that a little bit more. You know, is it kids 0 to 12? Is it teenagers? Is it 20-somethings? Can you give us a little bit more idea of what is that younger population coming in, and are you just seeing, a lot more kids compared to before?
We are seeing a small increase in pediatric patients. The absolute numbers are not large compared to the adult population, and a few of them do require intensive care. The thing to remember about the pediatric population is that when we're gearing up for RSV season, our children are back in school. Last year, we saw a dramatic decline in all these illnesses because everyone was home and everyone was wearing a mask all the time. This year, we anticipate to see those types of illnesses also occupy our pediatric beds. And so we are mindful of that, and we are, as you know, preparing for that with our pandemic influenza plan. But that is our concern, not just with the numbers of pediatric COVID patients, but that laid on top of the normal respiratory virus season that we encounter.
About 3% of the hospitalizations for COVID are pediatrics or children, but I think that number is deceptive because you can't really compare hospitalization rates and death rates of children against those of adults. We don't expect children to get hospitalized. We don't want or expect children to die. And so even a tiny number of children hospitalized and a tiny number of children dying from a preventable illness is way too much. And that's why we have to make sure that our kids that are eligible for vaccine, 12 and up, have to all be vaccinated. We don't want a single one to go to the hospital, and we don't want a single death. And we have to protect our kids that can't get vaccinated yet, under 12, because they can't get the vaccine. They have to be protected, which means the rest of us have to get vaccinated so that they don't get COVID from us. And so that's really the way to think about this is, what's tolerable for children to get sick and to get hospitalized and die. And I would argue that in something that's preventable, the answer is 0.
Thank you, Chris. And next we'll go back to Ryan Laughlin at KOB.
Thanks, Mark. I heard Dr. Mitchell say, it's on the ventilator question, it's not going to be an issue of equipment this time. We need to have the right people in the right places to issue the right care. And I know you guys said you're tracking your staff's vaccination numbers, although you said we're going to report it to the DOH. You didn't say, a majority of them are vaccinated. Do you anticipate when we reach that deadline and some people refuse to get vaccinated, that compounds the problems that you guys are seeing with occupancy and other issues? I mean, how serious is this going to be for the major 3 healthcare workers refusing to get vaccinated?
So Ryan, none of us has a crystal ball here, but I think it's safe to say that we don't anticipate an increase in staffing problems because for 2 reasons. One is, we have a high rate of vaccinations to start with. And, that really should tell the public something, that the professionals who know the most about vaccines and how they were developed are the ones first in line to get the vaccination. But also, we have examined our unvaccinated population quite closely. And you have to remember that a lot of folks who work in a health system are not actually at the bedside providing care. So when we look at all those numbers, we are reassured that we likely won't, I don't know for sure, but we likely won't have a problem with this because of the mandate.
I believe in the commitment of our teams and our healthcare providers. If you think about what they've gone through and what they've accomplished in the last 18 months, it's been amazing, and the sacrifices they made to do this. And I think that shows you what people are willing to do to take care of New Mexicans. And I think that you'll see them all step up and do what they have to do to protect one another and protect New Mexicans. And so we really do have confidence in the people that serve at Presbyterian and how they serve the community.
And I would agree with that and say the same, that all of our staff are committed. They're committed to taking care of New Mexicans. They're tired. They've worked hard through all of this, and they're still there. They come every day to take care of patients. And, the vaccine is part of what they do and part of what their commitment is to the healthcare system and to their patients.
Thanks, Ryan. And we'll go back to Julia Goldberg at the Santa Fe Reporter.
Thanks, Mark. Sorry. Real quickly, for those employees at your hospitals and elsewhere who are entitled to an exemption from the vaccine and have to be tested instead, would you consider the antigen test sufficient for those employees to feel confident that they're COVID-free on a weekly basis? A wonderful question, I can tell.
Sorry, Julia, the public health order just came out, and we are in the process of having discussions to operationalize all of that. So I don't have a definitive answer for you at this time. We do know that the frequency of testing will be once a week, and we need to make that as seamless as possible, and the reporting of that as seamless as possible for our employees. And we're working on that, and we're working on getting them vaccinated. But I don't have a definitive answer for you from UNM at this point in time.
Do you, oh, sorry. I'm wondering if there's concerns about the antigen test as it relates to our current situation. I was told by one person that they're not sufficient. I was told by someone else that they're fine. So now I'm just polling anyone I get to talk to.
I think, again, Julia, it's important to recognize that this order just came out, so we're all working on our processes and developing our processes to be compliant with the order. And so I think, we may have more information as to how exactly we're going to be able to track and test later in the week. But, our first priority is to get the vaccines in place. So, I can't entirely tell you with certainty how our process is going to look at this point.
Thank you.
Thanks, Julia. Next, we'll go back to Chris Mckee at KRQE.
Hey, thank you again. I did get one very specific question from inquiring minds here at the station, again, back to the ventilators topic. And I'm not entirely sure if you can answer this off the top of your head, but I'm going to throw it at you. So the question being, how many ventilators do you, how many people do you currently have on ventilators at each facility? And / how many can you run? Because I understand that it sounds like the equipment is there, but it's a matter of staffing and how many people you have. How many can you run sort of at your max capacity, perhaps, is the question. Thank you.
I think it's important to recognize that we will do everything we can to bring in as many people to care for patients. And we are already doing that. We're already expanding units everywhere we can. It means that people are working longer hours, they're working more shifts. It means we're pulling in agency, meaning people from out of state to come into the state. We've done a lot of work on that. So we will just pull every lever possible to bring in the people to take care of our patients. That said, it is finite. And the only way to prevent us from running out is for people to avoid getting COVID through COVID safe practices and to ensure that everyone is vaccinated.
And I would say when you look back at our past experiences through this, part of what has helped us and helped New Mexico is the collaboration between all of our systems and our ability to have flexibility and creativity and move patients, move equipment, share ideas, share equipment. All of these things have helped us considerably in these crisis times, and we are still doing that. We're actively doing that, and it's very unusual. I think with looking at other states, they don't have that same structure, and we are committed to doing what we need to do and expanding and being able to take care of New Mexicans. So we really moving forward do need your help though with the masking and the vaccinations.
Thanks, Chris. Does anyone else have a question before we bring today's media availability to a close? Seeing none. All right. Well, thanks everybody again for joining us. If you need a copy of this recording, please let me know and I will get it to you. And also it was on our Facebook page, which is UNM Health Sciences. Thanks again, everyone, for joining us today.
Thank you all. Take care.